ministry is aware of domestic areas of National Water and Sewage Corporation from the health facilities across the country. These areas have been accumulating for over 10 years. Chair, I want members to take note, 10 years, and continue to cause disruption in service delivery. In regards to the causes for the domestic areas in the health facilities, Honorable Chairpersons, there are two major causes for the health facilities accumulating such huge sums of money in debt that they are not able to pay for over these 10 years. Number one is inadequate budget. The facilities receive little money as non-wage recurrent to cater for water, electricity, security, cleaning, minor repairs, and other operational expenses to give services to the population. It should be noted that health services are free and no charges are imposed to citizens apart from those that can afford and go to the private wings at the regional referral hospitals and specialized hospitals. The above challenges have been registered mostly in general hospitals, which are by mandate under the district local governments, regional referral hospitals, and specialized health institutions. These facilities are high volume with patients, attendants, and they offer services that require plenty of water and other utilities like electricity. The current budget for these hospitals have been at the same level for more than 10 years. Chair, I wish members to mark that, the same level. Despite increase in demand for services, and services have increased, and also population growth. Let's take note that the population 10 years ago is different from the population today, and the disease patterns have changed over the years, but the amount of money remains the same for 10 years. And yet I am expected to pay for these utilities.
Mr. Chairman, this is basically a problem of bad or poor planning. Among the key issues that we are going to address in our budget, one of which is human capital development. Under human capital development, you have the hospitals where, if not, majority of our people go. On a daily basis, mothers are giving birth, we need water. People are being operated, and there are very many people in the hospital. Our sewage systems need to work. So there is no debate about the urgency and the need for water in our hospitals, in our health centers. Now, what has been presented here is that the total bills has been accumulated now is 101 billion shillings. What the National Water and Sewage Corporation is asking for is basically a debt swap for these water bills. And they are saying when they actually make their returns to URA in terms of VAT payments, this should be deducted so that whatever balance that would remain, then National Water would basically pay that balance. So without disturbing the Ministry of Health, we should agree for a debt swap so that this money is taken over by a bookkeeping entry between National Water and Sewage Corporation and the Uganda Revenue Authority. This is like picking from one pocket to pay. You are the same family. This is government to government, so it does not matter. So that we secure enough money for our hospitals. And
if it is true you're being overcharged or charged double, you have a window through which you should have negotiated with National Water without coming here. It is so embarrassing to drag the whole minister here on something you should have handled outside here. Honestly, we rely on you to hear that water is in billions. I can tell you without water, especially my sisters who are running the women hospital, you know how much blood pours and how much water is needed. If you wait to be dragged here and you drag your minister along and then you start telling us about pipes, you start telling about the other alternative sources, out of which I want to propose one, the free rainwater, which you can harvest. Because you have so many storied buildings, you can harvest it in stages. It will save a lot.
Have to, looking at the non-wage for Mulago, which is 36 billion, if I remove the amount which National Water wants currently, and also Umeme, then it would leave me with very little money, which I need to take care of medicine sundries, repairs, servicing of equipment, procurement of other equipment, among others. So, in short, we need more budget. Thank you.
If you have a white ant and you are asked to divide it between 1,000 people, you bring your razor blade, you cut. Tomorrow I add 2,000 people. It is still the same white ant, really. Can you even talk about planning and policy in that matter? It is not possible. It is not possible. We just have to look for a solution. You will even end up cutting your finger that you are cutting the white ant.
The minister has told you this is something they have gone through over and over. And indeed, even us as Parliament, we receive this over and over. It's one thing for the budget to be provided, but another for the money actually to be availed. Because sometimes there is a figure that somebody can look at Q1, Q2, Q3, and finally, by Q4, they tell you, now prepare for next financial year. Automatically, that becomes accumulated areas. I think the key thing is, as a policy, part of the people who decide on policy here, one of the ways we can help the ministries, which are actually part of government, is that when Minister of Finance, so to say, has an obligation, one, either you provide the money on the budget, or you indeed have the money used to settle the obligations in another. I'm sure that one of the ways to enforce the discipline will be that once finance knows that if we budget and you don't provide the money, then actually the money will be recovered in another way. Usually that is as simple as that. But